Welcome back, everybody, to my last brain cell. Happy Saturday, y'all. The weekend is finally here. I hope the first full week of October was good to you. I'm sure some of you are thinking to yourselves, wasn't this man just in a short sleeve shirt the other day? Yes, he was. It is just that brick, and I refuse to turn my heat on. So, hoodie and sweats it is. You feel me? A good pair of hoodie and sweats never hurt nobody, no way. Anyway, for tonight's shift, we are on to patient 2, Adrian Alexopoulos. Adrian Alexopoulos is patient 2, and we know we need some things from this package here. Struggling to put this back in this envelope. There we go. We need out that package. We got our pencil ready. Let's dive on in, y'all. Let's save another life today, shall we? This game is lit. I'm not gonna hold y'all though. Like, I'm really enjoying it. Okay. Epilogue. We don't want the epilogue yet. That's gonna go right there. All right. I got his EMR. I got his intake interview, and I got the patient form. And as we always do, we're gonna start with number 1. And let's read. Let's read his patient form. All right. Adrian Alexopoulos, age 82, male. Thea, a few years younger than her husband Adrian, meets you at the examination room door. She's crying and is distraught. Doctor, thank goodness you're here. My Adrian, I don't know what to do. He wouldn't get out of bed until afternoon today, except to go to the bathroom. He's miserable, but he's a tough guy, so he won't show he's having a hard time. He keeps saying he's fine, but a wife knows these things. Women intuition. That was me. That was ad-libbing. Thea talks quickly, and it's hard to follow her thick accent. Considering how upset she is, you realize that listening and letting her talk may help her calm down. Thea continues, he's been to the bathroom so many times today, I've lost count. He's been to the bathroom a lot, so that could be kidney stones. And tonight after dinner, he didn't want to eat my lamb stafado. I don't know what that is. I knew something was wrong. He loves my stafado. Who wouldn't like stafado? It's a slow-cooked stew made with lamb shoulder and onions, and the sauce spiced with cinnamon and cloves. It sounds delicious. I've been making it for almost 70 years, she says proudly. I even made Adrian's favorite. It's something Greek, I think, but without almonds because I don't like nuts. I'll put the word on the screen. If you know how to pronounce this, please help me. So you can imagine how concerned I was when he wouldn't eat any. He kept saying he was fine. He is so stubborn. He'd never admit he was sick. He wouldn't want me to think he's not strong. She wipes her eye. Stubborn old man. His mother warned me when I married him. My son is stubborn like a brick wall, she used to tell me. When he was a boy, he had his mother make his favorite snack after school every single day. A banana with a smear of peanut butter. Something to give him a little energy to keep up with his older brothers. Thea is quiet for a minute. Something you sense rarely happens. Then she says, he's been sick like this before. It usually happens after he goes golfing. I think he is eating some junk at the club that doesn't agree with his stomach. But tonight he's got me really worried. It's worse than it's ever been. He wouldn't even argue with me about calling the doctor. And then Thea breaks down and is unable to speak for a moment. I heard a crash and found Adrian laying on the bathroom floor. He was bleeding from his head. Ooh, and a contusion? I couldn't get him to sit up. I called the ambulance immediately. Adrian didn't say a word the entire way to the hospital. She grips your arm. Please help my Adrian. The patient is confused and lethargic. He is unable to understand or answer your questions. His wife Thea is more than happy to tell you anything you want. Okay. That is card 1. Confused and lethargic. Let's read his EMR, shall we? All right. Adrian Alexopoulos, age 82, male, 5'10", 170. He's a retired gardener. Complaints, head bruising, cut, confusion, and lethargy. Pelvis, diarrhea 70 times per day. Okay, so not kidney stones. It's something with his stomach. No recent illness, no recent travel. He's on medication. It's called Lacipronol. It's for blood pressure. Known allergies. He's allergic to penicillin. contrast, dye, and bee stings. His temperature is 98, so he's not feverish. His heart rate's 102. That might be a little high. His blood pressure is 140 over 90. That's definitely high. His RR, I don't know what that is. It's 18, and his oxygen is 95. No recent antibiotic use in the past medical history. He does have hypertension, high blood pressure, and he had his appendix removed at 50. They have 2 children, both healthy, no history of heart disease, and immigrated from Greece at age 33, age 23. I knew they were Greek. The last name really gave it away, but that food that I couldn't pronounce. The last name is how I knew, but the food I couldn't pronounce gave it away. Okay, admittance exam. Patient appears confused and lethargic, doesn't speak or respond to questions, pulse is steady, no contact with sick individuals. Wife has not had similar symptoms, so that means he's not contagious. He's cooperative, normal, no shortness of breath or cough. His eyes are sunken, no change in vision or hearing. His mucous membranes are dry, no sore throat, neck stiffness or tenderness. He is lethargic and confused. His pulse is steady. His heart rate is increased, but no palpitations or chest pain, no murmur. His capillary refill is 2 to 4 seconds. I think that's like some chamber in the heart. Normal muscle and joint pain. His abdomen is soft, non-tender, and not. There's no palpable masses. His extremities, there's no edema, so no swelling, and it's non-tender. His skin turgor, his elasticity is slow, so that means it doesn't snap back fast. Gastrointestinal diarrhea, non-bloody, so that's good. 7 to 8 times per day, 4 times, or 7 to 8 times a day, at least 4 days, or for the past 4 days. No, at least 4 days. He gets diarrhea every couple of weeks that typically lasts for 2 days. No vomiting, no fever. Appetite patterns, usually loves to eat, but not in the last few days. He's lost some weight. Possible ingestions. He and his wife ate out at the golf club last Saturday. They shared the steak, so the steak wasn't the problem. No itching, burning, or pain with urination. No hematuria, which is blood in the urine. Intake of fluids, always has his coffee, dark urine in small amounts, total urine output unknown. Oh, righty then. So he's lethargic and he can't talk. So it says I can interview Thea from story card 1. So let's go ahead and grab story card 1. And once again, every 2 questions I ask is just 1 action on this line. So there's 4 questions. I'm going to ask literally all 4 questions. Okay. What happens when Adrian goes golfing, and who has been in contact with him since he first had his symptoms are the first 2 questions I'll ask. But let's start with what happens when Adrian goes golfing, because she mentioned that he might be eating something there that could be disagreeing with his stomach. Although it does say in the intake form that they both went together. So PUQ, take story card 6. Let's remove the binding here. I kept it here just so you guys knew I wasn't cheating and that like it just was on it. You know what I mean? All right. Story card 6. Okay, Thea is more than ready to answer your question. Thea says, if you ask me, I think his golfing is the problem. It's the sun. He gets too much and it's not good for him. I try to tell him to take a hat. He takes the hat to quiet me down. Typical guy. But I know he doesn't wear it on the green. And sure as God made grass green, every time he goes golfing, a day or 2 later, he starts feeling sick, just like he is now. Well, usually not as bad. I'm afraid he might have. She looks away as if, excuse me, not wanting to face some awful truth. Maybe cancer, possibly. Finally, she turns to you. Thea says in a low voice, is he going to be okay? You assure her you are going to do everything that you can for him. Okay, so first one, golf? Question mark. PUQ and sun too intense for him. All right, now who has been in contact with him since he first had symptoms? BWV. Take story card 4. We live alone. Sometimes our children visit, but Sophia and Andrew live far away. Adrian goes golfing every first Sunday of the month with Bill, Dimitri, and Harry. None of them are sick. We've been in our brownstone for 37 years. So much has changed. We used to know everybody. Now they're all, what do you call them? Hipsters. Young kids with too much money. Adrian says that they don't know a thing about saving for the future. Like spending $3,000 on the bicycle. Can you believe it? That's more than my Reading wing costs, right, Adrian? Thea turns towards Adrian in the bed, then suddenly breaks into tears again. Damn, poor lady. Okay, so he's not contagious, and as we know, no one else is sick. Contact BWV. Um, Nobody. So he's the only person who's sick. What has he eaten in the past week? Because it might be some type of food poisoning, but we know it wasn't from the golf course because they ate the same thing from what she says. LXH. Excuse me. Take story cards 7 and 8. Things are getting spicy for the pepper, boys and girls. I meant to say folks. I don't know why I said boys. Anyway, start with 7. Thea says, 6 months ago, the doctor said I need to keep him active and told me to put him on a diet. It's not so easy telling a grown man he can't have his favorites. My Adrian, he is more stubborn than a mule, but I'm smarter than a mule. Thea says, smiling. I can tell you exactly what he eats because he eats whatever I make him. I bet that's wrong. I do all the cooking. Earlier in our marriage, you tried to tell me what to cook, and I told him I didn't tell him how to pay the bills. I buy fresh vegetables from the farmer's market in the village. I do the rest of my shopping at Bargain Food for less. Here, you can see the receipt. I do what I can to save money. I assume that's what this is here. Yeah, actually, I was right. I thought it would be actually a picture of receipt, but it's not. Thea says they had that canned chicken on sale again last week. Anyway, we both eat exactly the same thing every meal. We usually have oats in the morning and share a banana. I'm not sick, so it can't be the food. What? Does he sneak? Does he snack or sneak food? I know he doesn't sneak any food. Well, he does sneak a tiny chocolate candy once a day. They're my favorite. He thinks I don't notice, but I can tell. I'm the reason Adrian is still alive. Me and my cooking. If he ate the way he ate when I met him, he would have been dead a long time ago. She pauses, then becomes quiet. Take story card 15. So before we move on, eat. L X. I keep saying X because I want to say H. LXH. Possible cheat diet. Take story card 15. That's interesting to me. I don't know about y'all. We're going to ask every single question. Oh, it is a receipt. Okay. Bargain food for less, where you save more money. So she got ham pack, half and half, flour bunch, frozen salmon, happy chicken eggs, canned chicken, bananas, and sardines. Yeah. I mean, if they're eating the same stuff, I wonder if the ham or the sardines were the possible problem. I'm going to keep this over here to the side for myself. Last question I can be asking. Excuse me. USW. Has he been sick like this before? She said he's been sick and like it's happened when he comes back from the club, but he's not been sick quite like this. USW. Story card 3. It's been happening for about 6 months. Damn. He's his usual quiet self. Then he goes golfing, and 2 days later, he gets a fever and stays in bed for 2 days. At first, I thought he was pretending to be sick to get me to take care of him, but he won't even go up to our rooftop garden. And trust me, it takes something serious for my Adrian not to check on his azaleas several times a day. I don't understand. He's been on a diet. He's supposed to get better, not worse. So he's almost definitely sneaking some type of food or doing something he shouldn't be doing. Sick before, question mark. USW repeatedly after golf. Okay, so we asked her all the questions that we possibly could. What can we do? I think the gastroenterologist might be the best move here. See what's up with his stomach. Yes. Or should I take a stool culture? I think the doctor. I think the specialist first, then the stool culture. So RSV for the gastroenterologist. RSZ. Sorry, the gastroenterologist says I can't tell you much more. With damn it, I should have taken the stool sample first. Ugh. And I'm sure any actual doctor who might have watched this was probably like, "You fool! You should have gotten the sample first." That's all right. NA. Okay, so now we're moving on to the 2 o'clock hour. So SDD for 2. Take story cards 9 and 10. These double story cards are really freaking me out, y'all. I'm not gonna lie. Story card 9 first. When you check on Adrian, Thea pulls you aside nervously. All these tests, how much are they going to cost? Not that we wouldn't do them, but Adrian usually takes care of things like this. You assure Thea that Adrian's tests are covered. She sighs in relief. I work hard to take good care of Adrian. I feed him well and save what I can by shopping the specials at Bargain Food for Less. It's gotta be something with this food. It takes extra time to shop the specials, but I have plenty of that at my age. A few months ago, they had canned chicken Adrian likes to have on a salad and fancy peanut butter for just $2 a jar. What was the point of that? Why did they put that in two different cards? Anyway, I get all sorts of bargains: honey, ham, canned tomatoes, even sardines. Last week they had salmon, freshly caught, not farm raised, and eggs. They always have great deals on eggs. He's eating much healthier, so I don't understand what's happening. Well, we're about to find out right meow. We're going to take this stool sample. JUH. Anything on the back of this for tests? Yeah, other stuff, but we're gonna take this. Oh, I probably should have taken something for his head because he's confused and lethargic. I forgot about that. We'll do that in a little bit. Especially because like the sickness is like the thing. Like him being sick is what caused him to fall over and hit his head. So right now my brain is just all about like, let's figure out what the underlying thing is, and then we'll figure out if he's like, if his head's okay. Although I guess most doctors probably would have been like, all right, check his head first and we'll figure out everything else after. But I'm an orthodox like house. So let me do my stuff. All right. Let me do what I gotta do. All right. 28. The gastroenterologist shows you the stool culture results. Well, this explains a lot. Your patient has salmonella. Oh, that fucking sucks. All right. So he's got salmonella. All right. That sucks. Okay. I think now is a good idea to do his brain scan. So brain scan between 2 and 4 DTC. All right. So we know he's got salmonella. We need to check his brain now. Taking card 14. The neurologist says, compared to scans from when he was 42 years old, it is clear this patient has brain atrophy. Brain atrophy is likely due to normal aging, possibly some from dehydration. However, he does not appear to be at risk for stroke or brain injury. Perfect. So his brain is normal. Brain normal. And yeah, no wonder he's dehydrated. The nigga has salmonella. So he's eating something. It's either going to be something about this canned chicken, but I'm pretty sure his wife had it too, or it's going to be something that he eats at the, what's it called? Um, I don't know. What the hell's that thing? What's it called? Come on, y'all, help me. The golf course. So there's a few different things on here as far as like testing things, but I want to understand exactly what they do before I say I want to do it. So there's a blood test lab measures. I don't think I need to do that. No, he doesn't need. He doesn't have any carbon monoxide poisoning, so he's fine there. I don't need the urinalysis. I don't need. What does the? What's that one do? Yeah, I don't need that. But the abdomen scan. I don't think I need the abdomen scan either. So I just need to figure out what these drugs are going to do. All right. Antidiarrheal will probably be really helpful, but I don't think it's going to do anything to. Okay, yeah. So salmonella is not an infection, so antidiarrheal will only make it worse. whatever that C word is. Bacterial infections. Avoid use if patient has penicillin. Okay, he has penicillin allergy. Ciprofloxacin. I don't know how I know how to say that one. I probably butchered it anyway. Can cause adverse effects, including. But what is it for? It's an antibiotic. Okay, we're gonna hold off on that. Yeah, but I can't use it anyway. He has kidney removed. Epinephrine, an EpiPen. Yeah, he's not having an allergic reaction or IV fluids. Is that probably what he just needs his IV because he's definitely dehydrated? Okay, so let's get him some IV fluids, I guess. And then I gotta figure out what to do about his stomach because he has salmonella. But I guess him having uh what's it called is it's good news. IV fluids YGG YGG. Take story car 5. All right. What's happening now, Adrian? The IV fluids help Adrian recover from his dehydration. Almost immediately, Adrian becomes more alert. He's still not talking, but his cheeks are flush, and you hear him laugh at something Thea says. Thea is crying, going back and forth between thanking you and asking Adrian how he is doing. Now you can address his mysterious sickness. Take status card 2. Alert, but still sick. But we know it's salmonella poisoning. We just gotta figure out how to cure it, I guess. All right, I don't need status card 1 anymore. All right, take status card 2. All right, status card 2, and it is now 4. So we're gonna read what status card 2's got. It's QGH. QGH. Adrian is looking better after receiving the IV fluids, but he is still somewhat lethargic and slow in responsiveness. Perhaps there's something you've missed. So his brain is fine, so we know it has nothing to do with his brain. It's very normal. No risk of stroke or brain injury. So what am I missing? The stool sample is going to show the same thing. Status change. Good. Right? The stool's going to show the same exact thing. Should I take a urinalysis? What's that going to help me do? You know what? We're going to take a urinalysis. Just in case. Okay, Adrian's urine is dark but otherwise normal. You can rule out a urinary tract infection. Gosh darn it. All right. Urinalysis. PUE. Normal. All right, I'm running out of ideas now because I don't think none of these other medications are going to be helpful to him from what I can tell. The antidiarrheal is not going to help because I don't think that salmonella is an infection. It's a bacteria, right? So I can't use that one. See, but the other thing is not on here. Oh no, yeah, it is. Oh, did I read it wrong? Oh, okay. No, yeah. So I can't. I don't want to have to use an EpiPen right after. The problem that I'm having though is that it's gonna be almost my only option. I'm gonna have to give this man this ceftriaxone, whatever, and then potentially also have to give him an EpiPen because that's the only way to cure the bacteria infection. Because I don't like the epinephrine is not going to do that. He's not having a medical. He doesn't have a allergic reaction right now. The other thing, the ceprofloxacin, whatever. You know, I think I'm actually gonna have to use the other thing. I think I am gonna have to use the ciproflax and whatever, because I think it's the same thing as the Ceftra whatever, but yeah, I'm gonna use the. All right, we're gonna go for it, y'all. Wish me luck. The ciprofloxacin, whatever, ciprofloxacin, whatever. Yeah, because that one can cause it, but the other one will give him a severe anaphylactic reaction. So ciprofloxacin, whatever, FPC. Lord, take story card 30. I don't know if that's a good thing or not. I'm scared, y'all. Status, alert and improve. Let's go! Adrian's cheeks are red and he is laughing with fear. You have dealt with his symptoms and he is out of danger. Congratulations, Adrian has survived the night. As you leave Adrian's room, the hospital director pulls you aside. Good job with the old man, she says. However, it's important you find out the source of his illness. Depending on how he contracted it, this could impact a lot of people. That I agree with. Take status card SC4, alert and improved, and take story card 2. That I agree with though 100%, that like something somewhere he ate, which is possibly, and I said it earlier, probably that damn canned chicken. I don't remember if she said she ate it too. Something happened. It could be the canned chicken. Adrian is no longer confused. He's alert and improved. All right, so first of all, hold on. What was the other thing? We gave him the meds, FPC. Status improve. All right. No, it's challenging because his wife keeps interrupting. You get a nurse to distract Thea by having her pick a drink for Adrian so you have time to ask him one question. Woo! Okay, there's 2 questions here, and this time I can only spend 1 action per question. Okay. How do you think you got sick? Or tell me what happens when you golf. I'm going for tell me what happens when you golf. That's too juicy. That's too juicy a question. GOF. Take story card 33, then take story card 4. All right, we're going to put golf truth. It's at 33 then 34, right? Oh man, I'm so nervous, y'all. Oh, I'm so excited. Oh man. This is a good one. GOF. Take 33 and then 34. All right. Obviously, I'm going to pull out both, but I'll just put 34 over here. Put 32 here. Make sure I keep this right here. All right. I really look forward to my golf day. The guys and I take the train to Queens and shoot the back 9. It takes about 2.5 hours. I'm not as young as I used to be, so the walking takes a lot out of me. Thea packs my favorite snack to keep my energy up until we have lunch at the club. I usually have an Arnold Palmer, just one, half tea, half lemonade, and just a splash of vodka. But you can't tell Thea. She doesn't know. Don't know what, says Thea, who just returned to the room with a drink in hand. Adrian pretends to cough, and Thea hurries over to fuss over him. Congratulations, Adrian has survived the night. You continue your rounds to check on your other patients. When you return, you are surprised to discover an empty room. When you check in with the nurses, you learn that Thea convinced one of the doctors to release Adrian to go home. Whether you are ready or not, it's time to fill out your final report. Damn. When you've completed your final report, read the epilogue. Damn. Couldn't ask him more questions. The golf thing is what I was really looking forward to. So is that all it was, that he was drinking for golf? Okay. Anyway, what caused the patient's symptoms? Salmonella. And I'm going to put possibly, well, he did say that she packs him his lunch, yeah? So I don't know his favorite snack. So hold on. No, that's the thing with almonds. So that I don't think that's what it is. Oh, maybe it is. It is. He refused to eat it. It's a thing with almonds. I'm gonna put both. Possibly canned chicken or whatever the hell that stuff was called, which I can't pronounce. And again, and it's something without almonds. Or is this one? I'm, the thing is, it's. I bet you it's. I can't even try because I know that it's not gonna be pronounced phonetically. So like, I don't want to butcher it. Um, treatments. What treatments did we provide? That one pill. What was it called? Ciprofloxacin to cure salmonella. I think avoid canned chicken. Because other than that, he lives a very healthy lifestyle. All right, y'all. We're gonna see if I was right. We're about to grab the for a medium one, that wasn't that bad. That wasn't bad at all. I think my one yesterday was a lot harder because she was freaking out. All right. Adrian's confusion and lethargy are concerning. He might even have brain damage from this fall in the bathroom. A CT scan of his head shows that his brain has some atrophy, but indicates no immediate risk of stroke or brain damage, which was good. Adrian's diarrhea is alarming for a person of his age. He is likely dehydrated, which could lead to kidney failure. While an antidiarrheal will provide Adrian some relief, it does not address his more critical need to rehydrate. Hydrating Adrian with IV fluids makes him more alert and prevents potential kidney failure. Sweet. Next is Adrian's mysterious illness. By talking with his wife Thea, you can learn that his illness has happened before, always a day or two after he goes golfing with his friends. Given that the illness causes diarrhea, you have the option of taking an abdominal CT scan or a stool culture. An abdominal CT scan requires a contrast dye to take a good image, but Adrian is allergic to contrast dye. A stool culture is a more appropriate test. I'm glad I took the stool culture. This reveals that Adrian has salmonella. If you delay discovering this, the combination of dehydration and salmonella could result in sepsis, where the infection triggers a chain reaction throughout his body. Antibiotics are the best course to treat salmonella, while ceftriaxone is typically preferred over ciprofloxacin. Because of ciprofloxacin side effects, Adrian's allergy to penicillin eliminates the use of ceftriaxone, as it might cause him to have a severe anaphylactic reaction, which I avoided. If Adrian were to have such a reaction, epinephrine might need to be administered immediately to prevent death. With IV fluids and the right antibiotics, Adrian's situation can be stabilized so he survives the night. However, salmonella represents a potential threat to others. You need to identify the source to prevent Adrian or others from contracting it again. But Adrian and Thea eat the same food, so why doesn't she have salmonella? And why does Adrian keep getting sick? Sometimes the patient and their family hold their clues to their condition. All right, here we go. Thea is worried about Adrian and her thoughts are somewhat scattered. Her recent grocery receipt doesn't give us any clues because this problem has been going on for months. Of all the foods Thea mentions, only the canned chicken, sardines, and peanut butter have a shelf life over the several months Adrian's condition has reoccurred. As you talk with Adrian, you learn that when he plays golf, he has lunch and a drink from the club. However, if this were the case, other people would have been affected as well. But Adrian also brings a snack with him that gives him energy. Thea shared that Adrian's mom made him banana smeared with peanut butter as a child to give him energy. But she also talked about having peanut butter a few months ago, even though she doesn't like nuts. It seems Thea overlooked that she makes Adrian a peanut butter and banana snack for when he goes golfing. It doesn't take much effort to find out what kind of peanut butter Thea bought and discover online that it was recalled for salmonella because 9 other people died, based on a true story. That's crazy. Congratulations. Not only have you saved Adrian, you have prevented others from being infected as well. I never would have guessed the peanut butter. Ever. 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 Okay, plus 50 points if Adrian survives the night. Got it. Plus 10 points if you confirm that Adrian has no brain injuries with a CT head scan. Did that. Plus 10 points if you hydrated Adrian before 4 a.m. Ooh, right at the cusp. It was the last action I did before 4. So plus 10. Plus 10 points if you gave Adrian antibiotics before 6 p.m. or 6 a.m. Once again, did that as well. plus 20 points if you uncovered peanut butter as the source of salmonella. If you didn't, Adrian is back in the hospital a few weeks later with the same mysterious illness. I did not get those 20 points because I never would have guessed it was peanut butter. I just kept assuming canned chicken. Minus 10 points if he had a severe anaphylactic reaction. He did not. And minus 5 points for each overtime action you took after 8 a.m. I took none. The thing is, he'll be back. But this time, I'll have to figure it out. But we didn't do too bad, y'all. For a medium patient, we didn't do too bad. That salmonella thing definitely took me for a loop. And this time I know to do a lot more tests. I still have the 6 o'clock to like 8 o'clock hour that I haven't touched at all. But next time I know, do more tests. There's something that I'm missing almost always for all these people. I didn't even get anything of his right. But I'm glad my boy Adrian survived the night. And speaking of night, I guess, yeah, he survived the night into the morning. And speaking of night, I'm going to get up out of here. You all have a wonderful rest of the night. Enjoy your weekend. And until next time, y'all. Make sure you like, comment, and subscribe too. I've been forgetting to mention that these games got me so distracted. Like, comment, share, subscribe. And until next time, this is King Echo signing off. The next one's also gonna be medium. So like we're gonna see if the next one's gonna be harder or about the same.